Sergeant James Ross was driving behind another military vehicle when that vehicle struck a roadside bomb, killing 4 of his fellow Marines. When Ross returned home, he was aloof, had reoccurring nightmares of the accident, and refused to get behind the wheel. These, along with irritability, flashbacks, and avoidance of places and people reminiscent of the traumatic event, are classic symptoms of post-traumatic stress disorder, or PTSD. Once Ross was diagnosed with PTSD, he began to attend therapy twice a week. The most traditional approach to treating PTSD is prolonged exposure, or PE. In PE, patients participate in activities reminiscent of the traumatic event and engage in talk therapy to cope with their stress. But Ross receives virtual reality exposure therapy, or VRET. VRET immerses participants in a video game-like world that they can negotiate to overcome a fear. Forms of this therapy vary from a simple laptop and headphones configuration to more complex systems that create visuals, sounds, smells, and vibrations. By being exposed to event cues such as loud bangs, certain odors, places, and other triggers in controlled doses, participants can learn to cope with intrusive memories and other symptoms of PTSD. Ross's reality, for example, places him at the wheel of a vehicle similar to the one he was driving when he witnessed the accident. As participants undergo VRET treatment, their symptoms may decrease, and they may endure less experiential avoidance, that is, the avoidance of places, people, and actions reminiscent of the traumatic event. Using functional MRIs to monitor cerebral functions of PTSD sufferers, researchers have attempted to prove VRET is more effective than PE. Although the results of their studies have been inconclusive, VRET has helped participants face their traumatic events. Before switching to VRET, Ross opposed therapy and avoided talking about the accident. By being placed into a virtual representation of the event, however, he was able to confront the memories and begin to process them. For more information on the topic of PTSD, visit the PTSD page of the U.S. Department of Veterans Affairs website at ptsd.va.gov.